Hi, in this video, I'll be talking about how to take care of your nails during breast cancer treatment. Nail changes are quite common with breast cancer treatment, in particular with chemotherapy and with tamoxifen and the aromatase inhibitors. I'm going to start with chemotherapy and tell you what you might see. There are two main types of things you'll see. One is discoloration, and the other are lines in your nails. Discoloration starts at the nail bed, and depending on how much pigment you have in your skin, your nails can actually become very, very dark. They can become black. And this is really distressing to people. It's nothing you've done wrong, and it's nothing wrong with your nails. It's just the way your body responds to chemotherapy. These changes will fade over time. I have never seen them persist. But nails can take a long time to grow out. Toenails can take up to a year to grow out. So just be really patient and be confident that these changes will go away. But I have to say, this is one of the side effects a lot of people don't expect because often we forget to tell you, and it can be really upsetting. The other type of change you can see are horizontal lines in your nails. Sometimes with each cycle of chemo, you'll get a rapid amount of nail growth, then it slows down, then with the next cycle, another rapid period of nail growth. So you can get these horizontal ridges in your nails. You can actually sometimes count the number of chemotherapy cycles you've had based on those ridges. Those ridges will also grow out. Now, many of my patients have told me their nails have become stronger during and stayed stronger after chemotherapy. I wish I could promise that for everybody, but there's something that happens to rapidly dividing cells. And just like hair texture can change, it seems like nail texture can change as well. So your nails may actually, at the end of chemotherapy, end up healthier and stronger than they were beforehand. You can also get vertical lines in your nails if they become very dry, and we see that more with endocrine therapy that lowers estrogen in your body or blocks estrogen in your body. So nail thinning is something that we see in people on endocrine therapy. This does get better after endocrine therapy is stopped, but remember, endocrine therapy is given for 5 to 10 years. So it can be a really long time, and you may lose all hope that your nails will go back to normal. We see changes like this after our ovaries stop functioning as well. So it's really part of the endocrine system. You can also have nail changes with other medical conditions that have nothing to do with breast cancer and its treatment. For example, thyroid problems and other vitamin problems. So it makes sense to have your medical team do an evaluation for other medical problems as well. Next, I'm going to talk about how to cope with the nail changes. What a lot of people do if they get nail darkening, nail bed darkening from chemotherapy, is they wear a dark nail color polish. So deep red or a dark color that can help cover up the darkening of the nail bed. And this can be quite dramatic. You can go sparkly, you can put nail decals on, but I do recommend you avoid professional manicures because you don't want any excessive instrumentation of the nail bed, or the cuticles. You want to be really tender with the nails. So in addition to nail polish, that makes me think I should tell you, try to use a nail polish remover that doesn't have acetone. That's very drying. But in addition to using nail polish, we do recommend that you avoid keeping your hands in water for a long time, or having your nails in the dirt or in dirty soapy water if you're doing dishes. So wearing gloves just makes a lot of sense. The other thing that's very helpful is to keep your nails trimmed very short. It is one of the side effects of docetaxel and paclitaxel and even other chemotherapies that the nail can lift off the nail bed. We don't see that as often as we used to, given the different schedules we're using, but it does occur. And losing a nail is understandably very upsetting for people. In that case, you may want to see if it's on your foot, a podiatrist, or you may want to have special medical attention paid to the nails on your fingers. So one way to decrease that is to keep the nails really short so nothing traumatizes them or jams into them. It still may happen though that the nail may lift off the nail bed and you may lose the nail. It will grow in. It does take a long time. I've covered a lot, and I know if this happens to you, it can be really upsetting. It is not the majority of people who have these dramatic side effects, but a lot of people do get some changes to the appearance of the nails. If it's been helpful, click like and subscribe. Drop a comment below and tell us about your own experience and your tips for the rest of the Yerbba community. And as always, you can go to yerbba.com for your personalized report.